Hi, I'm Fiona Van Over, certified personal trainer and pre and postnatal exercise specialist. I'm here representing pregnancywellness.org with Dr. Raul Artal to discuss the most commonly asked questions about pregnancy and exercise. Dr. Artal is a professor of obstetrics and gynecology with expertise in high-risk pregnancy and is also an exercise scientist. He has been the main author of guidelines for exercise and pregnancy for several national and international organisations. So, let's get on with our interview. Hi, Dr. Artal.
Hi Fiona, what a pleasure to be here with you.
Well, thank you. So, we're going to go to our first question. Is it safe to exercise during pregnancy?
Absolutely, it's not only safe, but it's desirable that every single pregnant woman exercise and be physically active in pregnancy.
Are there benefits then of exercising during pregnancy? Could you give us some of the benefits?
Multiple benefits, just like for non-pregnant individuals, pregnant women can derive the same health benefits through an active lifestyle, such as cardiovascular, maintaining an adequate body weight, being able to prevent certain complications of pregnancy. It has been proven that women that are physically active in pregnancy can prevent gestational diabetes, preeclampsia, which is high blood pressure in pregnancy, and also avoid delivering very large babies, which usually get also very sick.
Right, and do we think that it can also help postnatal, after pregnancy? We often talk about maybe there being a benefit to exercising for...
Absolutely. As soon as medically safe, every single woman should return and be physically active in the postpartum period.
Right. Now, a common question or something people run into is, can I start an exercise program while I'm pregnant?
Absolutely. Contrary to past beliefs, when women were taught not to exercise in pregnancy and to be sedentary, now we do recommend that pregnant women engage in exercise in pregnancy, even if they were not physically active prior to pregnancy. As a matter of fact, pregnancy is an ideal time to start an exercise program, since women have more access to medical care than any other time in their lifetime. And they see a physician at least 8 to 10 times during their pregnancy. And should any complications occur or any questions, their physician should be able to assist them and help them to continue to be physically active.
Well, that makes perfect sense. How long should you exercise while you're pregnant?
Just like non-pregnant subjects, pregnant women to derive health benefits from exercise should engage in at least 30 to 40 minutes of exercise at least 5 times a week, preferably every day.
Okay, so there's been a lot of talk about heart rate during pregnancy, that it should not exceed 140 or maybe 150 beats per minute. Do you have any opinions on that, or how to measure the intensity of exercise during pregnancy?
I'm responsible for the 140 beats per minute statement, and in retrospect, I was sorry many times that I expressed that opinion. However, it's based on what we recommend to non-pregnant subjects to exercise to about 60 to 80% of their maximum physical or aerobic capacity. And measuring heart rates during exercise is not practical, not for pregnant or non-pregnant individuals. We know that exercising strenuously in pregnancy is probably not desirable. So when someone exercises strenuously, she or he cannot conduct or maintain a normal conversation.
So we're talking about the talk test here.
What we recommend now to everybody, pregnant or non-pregnant individuals, to use the talk test as a measure of the exercise intensity.
So to sum up, with using the talk test, if you're exercising to a level where you cannot carry out a normal conversation, you should slow down or stop.
Exactly.
Okay. Are there any types of exercise I should avoid while pregnant?
Well, for obvious reasons, contact sports are dangerous and could result in significant injuries to both mother and fetus, so they should be avoided. Horseback riding, skydiving, and one activity that is absolutely contraindicated in pregnancy is scuba diving.
Okay, so no scuba diving, and then any sport that's dangerous when you're not pregnant continues to be dangerous when you are pregnant.
Absolutely.
Okay. Now, diastasis, which is has the appearance of the splitting of the abdominal muscles and a gap down the middle. Are there any exercises or anything one can do to prevent diastasis?
Well, prior to pregnancy, abdominal and back exercises can prevent the formation of diastasis. There are certain abdominal and back exercises that can be conducted in pregnancy to maintain a strong abdominal wall.
Strong core.
However, sometimes in pregnancy it may not work. So, in those extremes, one may use an abdominal binder or other devices that are available.
Okay. Is there a maximum core body temperature?
We know that strenuous exercise in pregnancy that raises the temperature to above 103 degrees Fahrenheit could be deleterious, actually dangerous, and cause birth defects. It has been well proven in experiments and scientific studies. Later on in pregnancy, raising body core temperature about certain normal levels, and certainly 1 or 3 is very abnormal, can lead to dehydration and to premature labor, and sometimes in rare occasions to the separation of the placenta. So it's not recommended, just like for non-pregnant individuals, to exercise when the environment is hot and humid, and can lead to hyperthermia and complications of hyperthermia.
Okay, thank you. Varicose veins, it's obviously a problem for some people during pregnancy. Are there any exercises or anything one can do to prevent or minimize varicose veins?
Exercise, unfortunately, cannot correct or help in remedy the varicose veins. If they occur in pregnancy and they become bothersome, then one should use elastic stockings and or
Like those
constricting
compression stockings?
Compression stockings, and just try to keep the legs up while not exercising.
Okay. Now, people often talk about eating for two in their pregnancy, and it kind of gives us a ticket to go crazy with food. What is the caloric cost of pregnancy, approximately?
The maximum caloric cost in the second half of pregnancy is a maximum of 300 calories a day.
That's the maximum.
That's the maximum.
That's not very much.
So that's about 1 glass of milk or a couple of apples.
So I have a couple of 300 calorie-ish snacks written down here. Approximately 2 pieces of fruit, some raw vegetables with 2 tablespoons of hummus, a piece of toast, depending on the size of the piece of bread.
And no butter.
With no butter.
Right.
No butter. A couple of handfuls of dried fruit and nuts. So really what we're saying is it's not really eating for 2 in the traditional sense that people
should always eat for 1. The baby actually, even before delivery, an additional maximum 8 pounds does not require much food.
Does not require much food. Well, that's all the questions we have for today. Thank you so much for answering these. We want to remind everyone that before embarking on an exercise program during pregnancy, you should receive clearance from your physician. And we would like to wish everyone a happy and healthy pregnancy.
Absolutely.
Before engaging in the following exercise program, you should consult and obtain medical clearance from your physician. All you need is a water bottle for hydration, a couple of small weights, and a little space. You should be able to complete this workout throughout your pregnancy. Well, let's get going with a 5 to 10 minute warm-up. Take a walk outside or march on the spot to warm up your muscles, increase your circulation, and raise your body temperature a little bit. Starting with squats, targeting the glutes, the hamstrings, and the quads. Great for keeping your legs strong and looking lean. Stand with your feet hip width apart and go ahead into your squat as if you're sitting down into a chair. If you have any instability, hold the back of a chair for balance. We're going to be performing 2 sets of 15 repetitions of each of the exercises. Moving on to lunges. Lunges are perfect for defining the legs and waging war on those saddlebags. Stand with your legs apart like this. Hold on, if you like, and perform your lunge in a comfortable range of motion. 1 foot behind the other, knees in alignment with your feet, and lowering yourself down and back up. If you have knee problems, you can do leg lifts instead of lunges. Our next exercise is our side squat. Stand up straight, take your right leg and step out to one side, bending that right leg. Step back to center and alternate with the other leg. Now we're going to do some calf raises. These are very good for circulation. Sometimes people will experience some bloating in their feet during pregnancy, and this will help with that. Merely stand up straight, hold your stomach nice and tight, and lift up into a tiptoe and back down. If you want to make this a little bit more intense, stand on a step and push up, and then when you come back down, your heels will drop lower than the step. Moving on to our shoulder press, an upper body exercise. Pick up your dumbbells, or if you don't have access to some dumbbells, you can easily use 2 cans of beans. Stand up nice and tall, engage your core, and push the dumbbells or the cans above your head, just like this. Now we'll go to a bicep curl. Stay in that same position and just lower the dumbbells down to your side and back up. Be careful not to sway your back or move your upper arm. Your hinge is going to be your elbow here. Now we're moving on to a tricep kickback. This is going to target those muscles in the back of your arms, and they should feel a real kind of burning sensation while you're doing this. Again, your elbow is your hinge. Tilt forward slightly and push the dumbbell back, and then lift it back up towards your shoulder. Don't swing your arms, just hinge at the elbows, only moving your lower arm. Now we're going to move on to some push-ups. Climb down onto the mat, and if you can do a full push-up, that's great. If not, drop down onto your knees. Your push-up's going to target your chest, your back, your triceps, and your shoulders, and your core. This is a really, really great exercise. As your pregnancy progresses, you will need to reduce your range of motion. Make sure that your back doesn't arch as you push back up into the start position. Now we're going to move on to a really nice stretch, the cat and camel. Stay on all fours, hands under your shoulders and knees under your hips. You want to lift your back up to the sky and then drop yourself down to just below a neutral position. This will feel like a really good stretch, especially as your pregnancy progresses. And now we're going to go into another stretch and a back strengthener. This is an important one. It will help keep your lower back strong as your baby belly starts to pull into your lower back and can often cause discomfort. You want to stretch out your opposite arm and leg just like this and then pull it back to center. Try to keep your hips still and your core engaged. And now we're going to go into another ab and back strengthening exercise. Have your hands just wider than shoulder width, and you're just going to let your hips drop in front. Catch it when it starts to pull a little bit on your back and pull yourself back using your abdominals. Moving backwards and forwards, you'll feel your core engage. If you feel any discomfort doing this, then stop doing the exercise. Our next exercise is our side plank. It's It's going to target the muscles around your waist, your obliques. You're going to lean onto your elbow, bend your knees slightly, and lift up from the hips. Push up as high as you feel comfortable from your hips. If it feels very challenging, then bend your knees a little bit more. It will make your lever a bit shorter and it'll make the exercise a little bit easier. You should be able to keep doing this exercise well into your pregnancy. Now on to another abdominal exercise. This will work your core again. Sit down, lean back as far as you feel comfortable, and then pull yourself back up again. These should only be done if you're pretty comfortable with your ab strength. Again, if it causes any discomfort, just stop. The next exercise are these twists. If you're comfortable doing the sit backs, you should be fine with the twists. Lean back as far as you feel comfortable and twist your body from side to side with your hands clasped. Bent over rows are very good for your back strength. Once again, really important to have a strong back during your pregnancy. It can really help with any discomfort.